Hi, I'm Dr. Madhvi Reddy, Consultant Obstetrician and Gynecologist at Motherhood Hospital, HRPR. Coming to its definition, blood pressure more than 140/90 after 20 weeks of gestation, checked on 2 occasions 6 hours apart. We consider these pregnant ladies to have hypertension diseases in pregnancy. So, this accounts to about 5 to 10% of all pregnancies, and 16% of maternal deaths are because of hypertension disorders in pregnancy. So, this is the reason why we give lot of importance for this. We classify hypertensive disorders into 4 categories. First one, gestational hypertension, where there is only recorded readings of BP to be more than 140/90. Second is pre-eclampsia or eclampsia syndrome, where the BP is more than 140/90 associated with urine albumin, which is present in the urine. Coming to the third one, chronic hypertension, where a woman is hypertensive even before the starting of the pregnancy. The fourth one is pre-eclampsia with chronic hypertension, a woman with hypertension before the pregnancy associated with albumin positive in her urine. So this is how we classify hypertensive disorders in pregnancy. The reasons for this could be placental changes or maladaptive changes of the maternal, paternal and fetal conditions, or maternal maladaptation to the cardiovascular and immunological changes which is taking place in the pregnancy. So women who are at risk for these are first pregnant ladies, age more than 40 years, or a woman who gives a history of hypertension disorders in her previous pregnancies, family history of hypertension, or a woman is having chronic renal disorders. These are the conditions where the mother is at high risk of developing hypertension. Nowadays, we can predict women who can have these hypertension disorders by checking the uterine artery Doppler values, which is checked at the earliest at 12 weeks of gestation. So, women who have a higher incidence of having a hypertensive disorders, we start them empirically with a low dose heparin or low dose aspirin medication for these women. Diagnosis is by blood pressure measurement, renal function test, liver function test, coagulation test, or a patient gives history of developing swelling in both the legs, and we notice any weight gain of more than 1 kilo in 1 week, it is to be taken into consideration, and we have to keep these patients on regular follow-up. Danger signs in hypertensive disorders are headache, blurring of vision, decreased urine output, epigastric pain, decreased fetal movements. So if you experience any of these symptoms, you have to report as an emergency to our emergency department. Coming to the management of hypertension disorder, it depends on which category you belong to. Just a gestational hypertension can be managed with antihypertensives, and pre-eclampsia, if not severe, again this can be divided into severe or mild forms. Milder forms can be managed with antihypertensives. If it is severe form, they may require hospitalization and frequent blood test on her renal parameters, liver parameters, her coagulation status and her hemoglobin platelet count will be monitored more frequently. Coming to eclampsia, which is severe most and the leading cause of maternal morbidity, requires immediate admission as well as delivery, because hypertensive disorders main treatment is delivering the fetus. Once the fetus is out, the hypertension severity comes down. Thank you.